Good afternoon, Mrs. Johnson.
Hi.
It's good to see you.
You too.
I can see from your record that you've really been having some problems with this itching condition. And I can see the laboratory studies so far have been okay.
Mm-hmm.
How has it been affecting you?
I've had these hives for like 2 months. It's horrible. I am itching all the time, and my regular doctor did some tests and everything came back normal, and she didn't know what it was, so she sent me to you, and she said that you would be able to do more tests and help me figure out what's going on.
I know it's frustrating when this goes on and no answers have been given to you.
Yeah.
And I went through the records,
Okay.
and I went through your exam and your history, and the good news is you're a very healthy young woman that has urticaria or hives. But unfortunately, I don't really know what's causing your hives. And I know that's not what you wanted to hear.
No.
We use the term idiopathic urticaria to describe this chronic condition because it's gone on for so long.
Mm-hmm.
And idiopathic just means I don't really have a good answer. Some have even said your doctor's an idiot and you feel pathetic when someone says you have an idiopathic condition. And I know your expectations was I could do a test and figure this all out,
Yeah.
but I'm afraid that's not the case.
There's no test to just know what causes this, or...
We can do lots of tests, but it's not going to give us, I don't think, any answers. We can measure immunoglobulins to certain things inside your body, autoimmune tests. We can do food tests, but they don't give us answers in this condition. And I'm afraid what will happen is the test will be falsely positive, which means that we might get some information that it's a dead end. It's not going to give us any answers, and we'll do more tests and again, not have any more answers.
Okay.
But we're not going to leave you alone. We're not going to not treat you. We're going to give you medicines to try to help the symptoms. We want to advise you on things to do that might help reduce the flare-ups so your life can go on.
Yeah, I just, I never know when it's going to flare up. I never know how long it's going to last. Sometimes I wake up in the middle of the night from the itching. It's just unbearable.
Yeah, it's almost like your whole life is focused on this itching.
Yeah, and I don't know, it's scary because it feels wrong, and I Googled it, and I saw that some people who have hives, sometimes they have cancer or lupus, or like it goes inside your throat and your throat can close up, and I don't know, maybe do I need epinephrine or...
These are all great questions, and I do have some answers, but it's not as clear as I would like to make it, but it is not going to go into your throat.
Okay.
You do not have anaphylaxis, which is what you were talking about with hives
Okay.
associated with allergic reactions. And the good news, with your exam being normal and your history otherwise normal, you don't have lupus and you don't have cancer. And there's not any real test that I could do beyond that physical examination that's going to tell me any more than I know right now.
You sure?
I'm sure. I'm sure. Your doctor did some basic tests, which is all we need at this point. There's no value in any additional tests, but you should let me know if things change, if you have any new symptoms, if the hives change in some way, and we're going to continue to work with you and partner with you to make this better, but we'll have to use some medicines to control it until it goes away on its own. It may take, though, months.
Months?
Yeah, months. It's not going to be right away.
So I'm just going to be like this for months?
We're gonna help you through this for months, and keep in mind this is not in your head. This is not an anxiety condition.
Yeah, someone told me stress. Like maybe I was just imagining it because I was stressed out.
No, stress makes the itching worse, but it's not the cause of the problem. This is not a psychiatric condition either. So just like it's not a cancer and it's not an autoimmune condition, and it's not food allergy, it's not a psychiatric neurosis or some other problem. So again, we're going to get through. It's going to take some patience. I understand your frustration, but we'll work with you. We're going to give you some high-dose antihistamines on a regular basis. We may even add some other medicines in. But we'll try to stay away from the corticosteroids because of the side effects.
Yeah, I tried steroids, and they made me extremely hungry, and my blood sugar was elevated, and they didn't really work.
I know. Well, they help you temporarily.
Yeah, a little, but then it just came back.
The side effects are a problem.
Yeah.
We will try to stay away from that.
Okay.
And only use them very briefly if we have to. But again, we'll take care of you. We're not going to just sort of leave you on your own to work through this. So together, I think we'll be able to make it to where this goes away.
Okay, if you think so.
I do.